Good afternoon, ma'am. I am Ivory, student nurse from Medical Colleges of Northern Philippines. So, for today, I will do the administer medication through intradermal injection. So, the first procedure is to gather all materials needed, check each medication order against the original physician's order according to agency protocol, clarify any inconsistencies, check the patient's chart for allergies. Know the actions, special nursing considerations, safe dose ranges, purpose of administration and adverse effects of the medication to be administered. Consider the appropriateness of the medication for this patient. So, the third procedure is to perform hand hygiene. The next, prepare medications for one patient at a time. Then, read the medication administration record. Select the proper medication from the patient's medication. Then, check for the expiration date and perform calculations if necessary. Then, withdraw the medication from the ampule. And check for the level. Then, transport the medication to the patient's bedside. Ensure that the patient receives the medication at the correct time. Then, identify the patient, checking the name and identification number of the patient's identification band. Ask the patient to state his or her name. If the patient cannot identify him or herself, verify the patient's identification with a staff member who knows the patient for the second source. Then, close the room or the bedside curtain. Then, complete necessary assessment before administering medications. Check allergy, the bracelet, or ask patient about allergies. Explain the purpose of the medication to the patient. Then, perform hand hygiene. Then, put on gloves. gloves. Then select for the appropriate administration site. Assist the patient to the appropriate position for the site chosen. Drape as needed to expose only the area of site to be used. Then cleanse the site with an antimicrobial swab while whipping with a firm circular motion. With a firm circular motion. Then, allow the skin to dry. Remove the needle cap with the non-dominant hand by pulling it straight off. Hold the syringe in the dominant hand between the thumb and forefinger with the level of the needle up. Do not massage area after removing needle. Tell patient do not to rub or scratch site. If necessary, gently blot the site with a dry gauze square. Do not apply pressure or rub the site. Do not recap the used needle. Assist the patient to a position comfort. Then remove the gloves. And dispose of them properly. Then perform hand hygiene. Observe the area for signs of erection at determined intervals after administration. Inform the patient of the need for inspection. Then last, document the procedure. And that's all.